Alright, so now we're going to talk about the orientation to the technical day. We finished the OSCE and now we're moving on to the technical. So orientation to ADC Part 2 exam, the technicals part, that's going to be on a separate day from the day that you have the OSCEs. We know that the ADC exam Part 2 now is about 2 days. Alright, 1 day is dedicated for the OSCE. It's an OSCE day. We said that it has 10 stations in total. 6 stations are going to be for communication cases or a patient interview, and is categorized into 3 clusters. We said the clinical information gathering, the diagnosis and management cluster, and the clinical and treatment evaluation cluster, which each cluster has two stations, except the clinical and treatment evaluation has 6 stations, 2 for communication and 4 for performance OSCE or skilled OSCE or technical OSCE, such as the LA, Perio, and all of that. And then you have the technical day. With a technical day, you're going to have a preparatory cluster. So for preparation, it's mostly, from the word, you're going to cut teeth and prepare teeth, and then you're going to have the restorative cluster where you're going to have teeth already pre-prepared for you, and you are asked to restore the tooth. With the preparatory cluster, you are going to get a PFM, a porcelain fused to metal, or a crown preparation if you want to call it, an endodontic access. So you are only required to do the access. You are not required to do any irrigation or obturation or any preparation of the canals themselves. You just need to get the access into the pulp chambers and reach the pulp horns. Cavity preparation. With the cavity preparation, they used to ask for amalgam and composite. Now they're only asking for a composite. So the cavity requirements are according to composite, not to amalgam, which is quite easier because it's not very technical anymore, and it doesn't have to have like specific criteria such as 90-degree cavity surface margin or completely rounded axiopulpal line angle, conversion wall, and all of that. And basically it is caries removal. So there's a tooth with caries and you'll have to remove it and get a cavity design that is suitable for composite. The restorative cluster, you are required to do a complex amalgam restoration. So complex amalgam restoration means that you are going to need to do a cusp buildup. Alright, so you're not going to get just a normal MO cavity or MOD cavity where you're required to do a normal class 1 or a normal class 2. It is going to be a complex. It's mostly coming as MOD. Sometimes it comes as MO, especially in upper. We'll talk about that in a couple of slides later, but you are required to build a cusp, restore a cusp. The complex composite restoration, the same. So it used to be just the normal MO or MOD or DO. Now it's an MOD or an MO or DO with a cusp buildup. All right, and we'll talk about the teeth that comes as well. With the provisional crown restoration, you are required to do a provisional restoration or a temporary crown on the tooth. It used to be on a pre-prepared crown prep that you were required to do the provisional restoration on it. Now it's basically after you do your own PFM. So on your preparatory cluster you are required to do a PFM, then in the restorative cluster you are required to restore this with a provisional or a temporary crown using provisional material.